being able to have affordable housing and supportive services, it's something that is a must. It really is. I became homeless at the beginning of the pandemic, so I went to move, and the guy decided after I'd moved out of my apartment that he wasn't gonna rent the house to me. It was scary, living in my car. I have 2 kids, so I was bound and determined to find housing. I called 211 and asked for help. I got a caseworker, and she was like, I found these townhouses. I didn't even look at the place. I said, I want it. I believe it was the day before Christmas Eve, I got the keys. It felt so good, like I had a safe place. It felt incredible.
My husband and I are disabled. I have what is called hereditary spastic paraplegia. We found out that the house that we'd been living in for almost 8 years was being sold, and we were not going to be able to continue renting there. So for 6 weeks, we were homeless. So we pretty muchly maxed out my credit cards to stay in a motel. I have to eat very specific kinds of foods. Good luck finding the kinds of foods I can eat at a motel or a fast food restaurant or something like that. It's not an option. I ended up weighing 102 pounds. The doctor said if I lost any more weight, they were just going to hospitalize me until I started putting it back on again. We tried every place to find a place, and because most renters want you to have 3 times the rent for your income, we were never approved for a place to live. I called up Gardner House. The person I spoke to on the phone, she gave me every detail that I needed. And then we moved into the Gardner House, and I think it's the first time we actually slept for 6 weeks. It's where we're supposed to be.
No matter who you are, where you come from, and where you live, everyone should have the same access to resources, from affordable housing to accessible health and wellness resources. We have resident services that can help residents with all aspects of their life, from out of school time if they have school-age kids, for health and wellness if they need resources for going to see doctors, or financial classes where they know how to budget, and also like community event where people can meet their neighbors and make new friends.
They make it fun, and there's fun activities, and you gotta bring your kiddos, and it's kind of like independent living, but you also know that there's a resource there to help you.
There is a community here. We help, we share. It means that everybody has that support group that everybody needs.
When the resident is stable in their affordable housing, there's all the barriers that they need to overcome: transportation, language barriers. We have a lot of residents coming from different countries, so when they came, they don't know English. They would need to learn more about the new medical system or educational system.
I enrolled in beauty school because that's always been a dream of mine. I was made aware of a scholarship through Mercy Housing and applied, and I've never won anything ever. And so I did win the scholarship through Mercy Housing, and that was amazing. If it wasn't for this place, I wouldn't have been able to finish school. I got to focus on school and being a mom instead of having to worry about juggling working like 2 dead-end jobs, and now I have a career.
When people are healthier, they can live in their full potential. They would be able to achieve their goal and their dream. We are very excited to have 2 grants that's supporting our health and wellness initiative. One is focused a lot on providing professional behavioral health support to our residents and also our frontline staff. And the other grant to providing more fresh and cultural relevant food to support the community.
I would say I had depression, but now I'm not depressed. I'm happy and I'm healthy, and I've lost 45 pounds, so I feel great.
Being able to have food I can eat, knowing that I have a place to put my head, is that much less stress. Having stable housing is very much healthcare.